So we will be testing cranial nerve 1. I'm going to need you to cover one nostril and smell the coffee. Can you smell it?
Mm-hmm.
Good. Cover the other nostril and smell the coffee. Can you smell it?
Mm-hmm.
Good. So that means her cranial nerve 1 is functioning properly. If she could not smell it, would mean it was abnormal. We are now going to test cranial nerve 2, which is the optic nerve. To test that, we will first check the patient's VAs. So cover one eye and look out there and read that line for me. TZVECL. Good. Now cover the other eye and do the same. TZVECL. Good. And the other way we're going to test it is we're going to check their peripheral vision by doing confrontation visual fields. So now I'm going to have you look at my open eye, and I'm going to hold up some fingers and tell me how many fingers you see. Again, and cover one eye.
2,
Good.
5,
Good.
1, 2,
Good. Cover your other eye. And now look at this open eye.
2, 1, 5.
Good. So since the patient had all normal responses and could see everything, her cranial nerve 2 is functioning normally. If she had any issues with any of those tests, it would be functioning abnormally. Next, we will test cranial nerve 3, the ocular motor nerve. First, but we'll test it by checking her pupil response. We're going to first check her direct response. Pupil constricted when light shine in it. Now we'll check it in this eye. Pupil constricted. Now we'll check her consensual. Both eyes are constricting when light shine in one eye. And both eyes are constricting when light shine in the other. And now we will check her swinging flashlight test to make sure there's no APD. And both pupils remain constricted. So her pupil response is normal. If it was abnormal, we would next check her accommodation. Now we're going to check her the movement of her eyes. I'm going to you look at my light and follow it with your eyes and let me know if you experience any pain or double vision. And her eye movements were sufficient and full. Therefore, her extraocular muscles appear to be functioning normal. Her eyelids also appear grossly equal and symmetrical. So, as of now, we would say that she has no abnormalities with her cranial nerve 3. The next muscle that needs to be tested is cranial nerve 4, which is the trochlear nerve. We were able to test this nerve when we were doing extraocular muscles. And since all her eye movements were normal, her trochlear nerve was functioning correctly. If it was functioning abnormally, she would not have been able to look down and in. The next cranial nerve we're going to test is cranial nerve 5, which is the trigeminal nerve. First, to test it, we're going to use this cotton swab to check that she has sensation of her cornea. So, look straight ahead. I'm going to gently touch her. She blinked. Her cornea has sensation. And good there. And now we're going to check the V1. And to do that, we're going to rub the cotton swab on her forehead. Can you feel that? Mm-hmm. Good. Can you feel that? Mm-hmm. Good. And now we'll check V2. Can you feel that? Mm-hmm. Good. Can you feel that? Mm-hmm. Good. And last, we'll check V3, which is on her chin. Can you feel that? Mm-hmm. Good. So she has all those sensations, so that's functioning correctly. Other tests we're going to do to check cranial nerve 5 is we're going to get her to move her chin and follow my movement. She will copy what I do now. So we'll go in, out, high. And since she was able to do all this tests correctly, her cranial nerve 5 is functioning normally. If it was functioning abnormally, she wouldn't be able to copy my chin movement, and she might not have sensation in any of these areas. The next cranial nerve that we're going to test is cranial nerve 6, which is the abducens nerve. We actually already tested this nerve when we did the extraocular muscle test. And since the patient was able to move her eyes laterally, the cranial nerve was functioning normally. If it was functioning abnormally, she would not have been able to move her eyes side to side. Alright, next nerve we're going to test is cranial nerve 7, which is the facial nerve. First, to test it, we're going to ask the patient if they've had any changes in taste, since the cranial nerve 7 innervates the interior 2/3 of the tongue. So have you had any changes in taste or any lack of taste?
Nope.
Good. So if she had any change, that would be an abnormal response. So since everything's normal, cranial nerve 7 is functioning normally. Next thing we're going to do is have the patient copy some facial movements that I make to make sure that everything is functioning properly. So first, I'm going to have you smile. Then I'm going to have you show your teeth. Then I'm going to have you frown and clench your eyes shut and blow up your cheeks. Good. So since the patient was properly able to make all those facial expressions, everything's functioning normal with cranial nerve 3. 7. Next cranial nerve we're going to test is the vestibular nerve, which is cranial nerve 8. First, we're going to ask the patient if they've noticed any changes in balance in their hearing. Good. So that's a normal response. If they had noticed any changes within the balance of hearing in each ear, that would be abnormal. Next, we're going to make sure the patient can hear within each ear. Can you hear that? Good. Can you hear that? Mm-hmm. Good. So if the patient couldn't hear either one of those noises on each side of the ear, that would be an abnormal response. But since she could, it was normal. So the next cranial nerve we're going to test is the glossopharyngeal, which is cranial nerve 9. First, to test it, we're going to ask the patient if they've noticed any changes in their taste, which is good. So that means that it's a normal response and abnormal response if they had noticed any changes. Next, we're going to make sure the patient's gag reflex is functioning normally. So open your mouth for me. And she gagged, which means her gag reflex is functioning normally. If it wasn't functioning, that would be an abnormal response, and we would have problems with cranial nerve 9. The next cranial nerve that we're going to test is cranial nerve 10, which is the vagus nerve. To test that, we're going to first have the patient open their mouth and say, ah, and that sounds normal. And now we're going to look at the uvula in the back of her mouth and make sure it's not deviate to one side. And it's not, the uvula is hanging normally. An abnormal response would be if the patient sounded hoarse or if the uvula was deviate to one side. Next cranial nerve we're going to test is cranial nerve 11, which is the accessory nerve. First, we're going to put pressure on the patient's shoulders and have them push up against it. And the resistance is equal between both shoulders, which means both cranial nerve 11s are working equally. Next, we're going to have the patient turn their head to one side and try and push against my hand. There's there's resistance there, and same thing here. And there's resistance there. So the resistance was equal between both sides of the cheek, which is a normal response. If it was an abnormal response would be if there was unequal resistance between the head tilt and between the shoulder shrug. Next cranial nerve we're going to test is cranial nerve 12, which is the hypoglossal nerve. To test this, we're going to have the patient stick out their tongue. Looks good. There's no furrowing, atrophy, or deviation, which would be an abnormal response, but since the tongue looks normal, everything is good there. We're also going to have the patient move her tongue between her cheeks. Good. And since the patient can do that on both sides, that's a normal response. An abnormal response would be if she couldn't.